obstructed meibomian gland disease. Indian take on Maskin probe.
Okay, so I'm presenting a very simple innovation as compared to the AI studies we have seen recently. So obstructive meibomian gland disease, these are the refractory cases where our typical treatments, warm compresses, repeated lid massages, oral doxy or azithromycins, topical antibiotics, nothing has worked. And these are usually patients from the poor socioeconomic strata who come to the charitable hospitals and the charitable OPDs, and they can't really afford the LipiFlow and other treatments that we are offering nowadays. So one of the landmark studies here was done by Dr. Maskin in 2010. He published this meibomian gland probing, where he introduced a steel probe into each of the meibomian gland orifices on the slit lamp. And after probing, he described that the patient had relief, and up to 12 months, he noted that there was lasting symptomatic relief. But, so this is the Maskin's probe, where the tip is introduced into each of the meibomian gland orifice, and they are available in 4 sizes, and 76 micron is the diameter. Now, this probe, it costs around $285 for 10 probes, and these are disposable probes. This is not actually affordable for our Indian population. So, and this study was then followed by another Chinese study who brought up the size from 76 micron to 160 micron, that is 0.16 mm, and they had similar results. So looking at the dimensions, we just thought what could be a cheaper alternative, and that would be a 34 gauge needle, which is used in the pharmacy trials for injecting the mice, and it is 0.159 millimeters, the outer diameter, and 4 mm in length. So it could be a very good replacement for Maskin's probe, that's what we thought. And then we used it on 20 patients. We anesthetized the lid margins using lignocaine jelly. Then we did warm compresses before for 15 minutes. Then each of the meibomian gland duct was dilated in upper lid as well as lower lid till a pop was heard. This is an audible pop which can be heard by the patient as well as the doctor, and the patient also feels a sense of relief just with that sound. And then the warm compresses were repeated for 15 minutes. So these are our patients at 3 months follow-up. You can see in the upper image the dilated and blocked meibomian glands, and in the lower image it has resolved. So we had 20 eyelids out of the 10 patients, and we followed them up for 3 months, and we excluded all patients with previous tarsal surgeries like entropion surgeries, and all patients of NLD or recurrent chronic dacryocystitis, whether active or treated, were also excluded. And most of our patients had they were in the old age, mean age of 55, and they had the disease for around 24 months, that is 2 years. And this is our meibomitis grade, which reduced from around 3.7 at enrollment, and we can see a persistently low grade of meibomitis over 3 months follow-up. And the pain score, which was done using the Likert scale, that also the patients had significant relief of pain, which was maintained for 3 months. I would like to add that the probing was done only once at the time of enrollment, and the effects were lasting for 3 months in the follow-up. And the Monk score for epiphora also reduced significantly among the patients. So what it adds is that the Western literature gives us a price of $28.5 per case, and we could bring it down to 10 rupees per case. It's a very simple procedure. You just have to probe each of the meibomian gland orifices, no learning curve, no pain, and the patient is reassured by that pop of each meibomian gland. So the patient hears around 80 pops for each eye, 40 in each eyelid.
That's awesome.
So that's kind of a placebo which works along with a therapeutic thing. So thank you.
How do you source those needles?
Sorry, ma'am?
How do you source those needles?
Ma'am, they are available on Amazon. They are available in the unsterile form. A pack of 100 is worth, I think, 1,000 rupees, and we just have to sterilize them. And we can use one needle for both the eyelids or 4 eyelids of a patient, but not for the other patients to avoid cross-contamination.
That's true. And the 34 gauge needle will go through the 40 pricks.
Yes.
It won't get bent or damaged.
Ma'am, it's a cannula. It's a 34 gauge cannula.
Yeah, but it won't, because 34 is thin. It's not going to get distorted.
Yes, ma'am. It's 0.16 mm, but we don't force them through the meibomian gland, or we can just perforate the conjunctiva and hit the globe or something. So gentle probing helps.